Morning, it's Tara. All things new, the confidence to try. Today's topic is insomnia. And if you're like many people in this world, you might be feeling or complaining of feeling tired each and every day. You're waking up in the night, having a hard time resetting your sleep back to falling asleep. So I wanted to touch on insomnia and how many people with mental, physical disorders such as anxiety, depression, even high blood pressure, heart disease, and diabetes have and suffer with this. I wanted to think of it in your context of your everyday life. Are you facing anything that's new? Perhaps it's a new job, a new approach to something, a new difficulty. Maybe you're not been feeling well, you're under the weather, you've added a new diet. Think about where you're at in your situation. As we think about this, I want you to reflect back in a journal. Is this when you started your insomnia episodes? Some people, sleep problems continue past these norms, months, years, and they become an issue in their lives. So what I want to do is talk about insomnia. So insomnia is when it lasts longer than a month. It's often due to poor sleep habits, false beliefs about sleep, and or excessive worry about fatigue and how it will impact your day. Keep in mind, certain meds or medical mental health issues can also interfere with your sleep. Check with your provider if that's what you're questioning. So changes made to sleep patterns in an effort to correct insomnia, such as napping during the day, early to bed, staying in bed later in the morning, may actually do the opposite for you and cause more insomnia problems. We start to worry about getting enough sleep, and it actually worsens our insomnia by making it difficult for us to relax or shut down in those moments. So cognitive behavioral therapy addresses the underlying issue of insomnia using a combination of strategies which teach people how to change unhelpful sleep habits, negative thoughts, and develop healthy sleep patterns. I'm getting this off of a medical Hot Flashes newsletter, and it comes to my desk as a nurse practitioner, and I thought it would be a good way to reach many of you that are dealing with insomnia. So some ideas and strategies I want you to consider when you're dealing with insomnia is to track your sleep patterns in a personal sleep diary. Sleep restriction. Reduce the time you spend in bed to the time that you are actually asleep. The increase in drive to sleep and at the same time consolidate sleep to promote more restful sleep. Sleep restriction requires setting regular bed and wake times and getting out of bed and leaving the bedroom if awake during the night. Stimulus control. Limiting the activities in the bedroom just to sleep and intimacy in order to rebuild the association between the bedroom and sleep. These include not reading or watching TV while in bed, and of course, removing your device. It's very distracting to many of us. Thought therapy identifies and addresses any negative or misleading thoughts or beliefs about sleep. Relaxation techniques helps to counteract conditioned arousal at bedtime or when awake in the middle of the night. So sleeping pills are easy to take and may work quickly in the short term, but they lose their effectiveness over time. However, even though they quit working, coming off them becomes hard because dependence develops within a few weeks. Cognitive behavior is challenging in the short term, but eventually results in long-term improvement. To be successful, a person has to commit to the following and be somewhat difficult at first. It may take a few weeks of this therapy before sleep improves. So don't expect quick responses because that's not reality for a sleep insomnia disease or disorder. Even though relapse may occur, a person trained in this has the skills to reestablish healthy sleep pattern. Sleeping pills have side effects such as the next day drowsiness, fatigue, which may weaken the concentration, and it slows our reflexes. It has a negative effect on work or school, as well as increases the risks of accidents and injuries. When taken regularly, many sleeping pills cause physical and psychological dependence. Physical dependence, meaning that stopping the meds will cause withdrawal symptoms such as anxiety, irritability, wet restlessness, shaking, stomach aches, short-term worsening of insomnia. Psychological means believing that you won't be able to sleep without your medication. Other than the temporary increase in daytime fatigue that may occur during the first few weeks of CBTI, it is not associated with side effects. CBTI can help reduce or eliminate their dependence on pills. So how to access this? Although the treatment of choice is not widely available, mainly due to a lack of trained providers, your provider may be able to refer you to a sleep specialist, but there is often a long wait list. So Pharm ZZZ is a research group at the U of S, College of Pharmacy and Nutrition, which trains pharmacists to provide this to people with insomnia. The aim of Pharma ZZZ program is to increase patient access to CBTI and reduce inappropriate use of sleep meds through our community pharmacists. For a list of the pharmacists that can offer this, there is a website, and I will just show it to you. It is medsas.usas.ca/document/CBTI document/pharmazzz percentage 20 pharmacist.pdf. Other options include online programs, Shut-Eye at www.myshuteye.com, Sleepio, self-help books, and Say Goodnight to Insomnia, Sink into Sleep. Pursuing one of the following above to obtain CBTI is very likely to be your best option in the long run. So I wanted to share a quick tip about insomnia because it is a common medical condition that comes to my door. It's difficult for me to prescribe pharmacotherapy for long-term insomnia because I do believe that it is something that we have to adjust in our own lives. Just like mental health, it is curable, but we have to work at curing the difficult moments. So enjoy your day. Remember, smile, harmonize, inhale, focus, and try.